To order the Yamhill County Board of Commissioners formal and informal session for April 16th of 2020. And we'll begin with the flag salute. Christian, can you lead us in the flag salute? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Kristen. And we'll move on to public comment, which is item C. And due to COVID-19 and social distancing requirements, we encourage anyone wishing to submit general public comment or comments on agenda items to do so in written format via email at bocinfo@co.yamhill.or.us or by mail at 535 Northeast 5th Street, McMinnville, Oregon 97128. Any comments received prior to the meeting will be shared with the Board of Commissioners and submitted to the record. And commissioners, you've, with the diligent work of Carolina, you've received lots of public comments. There's public comments regarding working conditions for Yamhill County employees. I think about 110 from what I saw. There are comments on the item 7 under other business, and we can get to those at the time because those aren't actually general public comment. And then there's comments for item number 5, and I'll bring those up when we get to that point.
Okay, thank you.
Any other thoughts on public comment before we move on?
Commissioner Chair,
Yes,
if I may,
please.
in light of a lot of the comments that have been submitted on behalf of the union and the things that that have been submitted for written comment, I just wanted to quickly provide a statement or provide an update on some things, if that is okay with the board.
Commissioners?
Fine with me.
Yeah,
Sure,
okay,
thank you.
I would appreciate that too. Thank you.
All right, so I just really quickly just wanted to go over I just wanted to share actions that the county has taken to comply with the governor's order, order number 20-22. That was the stay home, stay healthy order. And as you know, the executive order, while it excluded local governments, we were strongly encouraged to adhere to the policies underlying these directives. To comply with the governor's order, Yamhill County has been implementing and requiring compliance with the same social distancing directives that were also put in place for the state executive branch offices. And I'm going to run through a list or a summary of the actions that we've taken since that order to be compliant. Where feasible and consistent with the county's telework policy, and the one thing that I would point out is when we first started having folks work teleworking, we did not have a policy in place to accommodate teleworking. However, we worked with departments to try to get employees out teleworking while we were working on a policy to get one ready. And so the actual policy came out about a week after we already had a large number of folks teleworking from home. Right now, based on updates that I received at the end of last week, we have 294 county employees that are currently working remotely. And comparing that, we have about 554 regular employees that would fall into the category of, they could be full-time or they could be part-time, but I'm looking at regular employees that are more than half-time or above.
How many was that, Ken? 500 what?
554. And these are estimates too, because it can change, but so with the numbers, we have 294 employees working remotely. And these numbers can change depending on the needed on-site services or employees being out on one of the various leaves that are also available to those employees. Again, we tried to move as quickly as we could as the technology would allow to accommodate as much teleworking options as possible, and recognizing that, again, this is something that was new for Yamhill County. And so there was a lot of hurdles for us, both internally and at the department level to get into place to accommodate teleworking options. And that has steadily evolved over time. You know, as part of this being a new teleworking early on, and there's been a lot of comments about departments requiring employees to log time and report back to managers. I just want to specifically state that every department or each office, there's not a county-wide requirement or log that went out that you shall follow this or record time this way. It was up to the individual departments and the managers on how they were going to track and monitor those times, and it could vary and be dependent on the duties of the position, the type of work that they were engaged with, and also just a lot of questions that, this being new to a lot of managers, how they were going to track the time and to measure the effectiveness of being able to telework. You know, I have an example of a this is from HHS, and I think this is one that's been referenced a lot in the public comments. And, you know, it does have it in half-hour increments, and I'm not sure what the instructions that went out with it, but, you know, I just want to share an example of what the actual log is like, or a sample of that. Also, as part of, you know, so that was the teleworking. And then to the furthest extent that we could, we've closed county offices and buildings are closed to the public. There's a few exceptions to that, the courthouse being one as a building, even though a lot of our offices are not open to public access. The courthouse itself remains open. And then public health, for obvious reasons, it still has some public access. The Evans Street campus has some access, the family and youth. You know, there are a few buildings that are still open, and it's, you know, because of the services of being able to address crisis or issues that may come up. You know, and again, if the job functions or services can't be done remotely for these offices that are close to the public, and we're still operating, employees are expected to continue to report to work, and managers are making sure that we're adhering to social distancing policies. Every department has designated a social distancing monitor that is to be doing check-ins and making sure that employees are adhering to the directives that have come down on social distancing. However, employees who are concerned about continuing to report to work can utilize one of the various leave categories, whether that's under the collective bargaining agreement and the accrued leaves that they have, or if they have a qualifying reason for one of the other various leaves, employees have been able to access that. And I'm not aware of employees being denied leave at this point. For buildings that are open to the public, they've also taken additional steps to help maintain social distancing at reception counters, things like putting tape on the floors. And again, you know, most of these buildings also have limited access to the employee staffing area. A lot of these buildings that are open have secured lobbies, and the employees are working in another section of the building. Any required in-person interactions are to be by appointment and adhering to strict social distancing standards. However, we also recognize that there are certain functions in public health, mental health crisis, law enforcement, and other first responders that have to respond to unscheduled in-person interaction. In these cases, we are providing personal protective equipment. And we're also still ensuring that they're still maintaining and adhering to social distancing practices. Again, employees wishing to stay home and utilize their FET, vacation, or other leaves are being allowed to do so per the collective bargaining agreements and Yamhill County policies. Over the last month, Yamhill County has adopted the following policies, and specifically in response to COVID-19. We've adopted a paid administrative leave policy for employees needing to take time off due to diagnosis or quarantine order specific to COVID-19 or acting as a caregiver for either one of those categories. That's on the agenda for later today. To again, I'm recommending extending that policy again. Adopting a telecommuting, we adopted, like I said before, adopted a telecommuting policy which outlined requirements and process for requesting telecommuting options. I know there's been a lot of comments about the length of the document. The one thing that I would point out is that document is basically 3 documents in one. It is the policy document, a request form, and then a telecommuting agreement form. So it's comprised of 3 different components, and it was not intended to be cumbersome. It's just that there's a lot of making sure that, adherence to policies and how this teleworking is going to work, and also recognizing that we have a lot of accounting equipment to accommodate teleworking. We need to be able to make sure that we're accounting for that equipment that's going out the door and making sure that, we have that clearly documented. We've also have adopted policies, modifications to the leave donation policy, and this is to allow employees to donate leave to other employees experiencing hardship associated with the school closures or loss of child care related to COVID-19. Historically, the leave donation was strictly for somebody experiencing a prolonged health condition, but it was expanded. We also adopted a COVID-19 emergency leave policy, and that was for the expanded FMLA for the paid sick leave, and then also for the school closure leaves. So that was adopted, went into effect on April 1, and then a revised version of that went out on April 10th, and it's on the agenda today for ratification. In last check with Human Resources, we currently have 57 employees that have accessed one of these leaves. In addition to the policies in response to COVID-19, there's some additional steps that we've also taken with our facilities since the beginning of March. Facilities maintenance, through our contractor, we've been doing a weekly treatments of all of our facilities, and we've increased that to twice a week for those facilities that are still open to some public access. And again, work is really being concentrated on the high traffic areas, but they're coming in and doing a sanitation using, this pure taps deployment of a treatment of all the facilities. We continue to do that even though we don't have the public access necessarily, with most of our buildings still being closed to the public. We're still doing those treatments because we also recognize that we still have employees that are coming and going. And so we're still continuing to do those treatments. On top of that, facilities personnel have been doing daily enhanced cleanings that's being performed 3 times a day. And it's really concentrated on those high traffic areas, lobbies, and especially for those buildings that are still remain open to the public. Facilities continues to order supplies and ensuring buildings are stocked with cleaning supplies and hand sanitizer, but also recognizing that, like everyone else, there's challenges with supply and demand. But we are actively working, and Joe Moore is in constant communication with department heads and also Brian Young with emergency management, getting updates on supplies, needs, and placing orders, and then getting those materials out to those departments to make sure that they're fully stocked. The sheriff's office and the jail, and there's been a lot of releases, and you've seen some of the general orders. They've done a lot of changes as far as issuing operational orders regarding access to the jail and their sheriff's office facilities. And at the same time, they've also been addressing jail population and cleaning and treatments that are occurring within the jail as well.
Bless you.
Some additional actions I just kind of want to highlight as well for kind of internal interactions. For buildings that provide internal services to employees documented, we've really transitioned into a lot of electronic transmissions, timesheets, interactions with HR, a lot of the requests, that is being done via telephone or using electronic documents to get those submitted. And when we can't, where it has to be in person, again, like accounting staff, and if they're going through accounts payable and receipts, they're wearing personal protective equipment as they go through the stacks of stuff and get it scanned into the system to process for payment. Other things, as you know, Board of Commissioner meetings, we've scaled those back. We meet once a week now, and we're not open to public, attendance. And as you can see, we're spread out to adhere to that social distancing. And then also a lot of the meetings that we're doing, like when I'm meeting with department heads, a lot of that's being done via using Microsoft Teams, video conferencing. It's another thing that Shane and IT has been working really hard to help build up that capacity, because it's not all workstations had cameras and microphones, and we're slowly but steadily, as the supplies have been coming in, we're getting more and more departments up to speed on that. HHS has really been working hard in trying to expand telehealth opportunities and getting the equipment, and they've been actively engaged with IT as well at expanding the capacity for accommodating more of that. Most of the departments, when I'm getting reports back, is most of them are doing their staff meetings via the teleconferencing or video conferencing. County parks were closed on March 24th to comply with that order. And they're still, to this day, the county parks are still closed. We've suspended programs like the inmate work group program, that was suspended. Managers have also been actively working with employees for those that do have, where they're close to the public but still required to report, and looking at schedules and adjusting schedules to lessen the number of people if they have physical constraints as far as the size of the office, shifting schedules as much as possible to accommodate more social distancing. Public Works has taken steps on where they're not doing daily crew meetings. They used to typically have morning meetings every morning with the crews. They don't do that anymore. The supervisors are finding other ways to get work assignments out and go over projects with individuals. Public Works crews are also expected to maintain social distancing when they're working out on projects, and a lot of this is being accomplished by being assigned their own vehicles, or if they're being assigned to a piece of equipment by themselves. All vehicles, including pool fleet vehicles that are being checked out by the rest of the county, are being cleaned and wiped down with disinfectants daily. And then transit, as you know, has made several changes, including reducing services, working with drivers, making sure that they're actively cleaning bus interiors throughout the day. First Transit's also put in some temporary barriers within the bus to help further protect the drivers. Cynthia's provided, I know, a lot of updates on some of the actions and information that they've been putting out from Transit. So I'll just, there's more details that Cynthia can provide on that. So again, I just wanted to quickly go over, and this is just a really quick summary and doesn't necessarily encapsulate, doesn't cover all the various steps that we've taken over the last 5 to 6 weeks in trying to adhere to the social distancing, comply with the governor's orders, and then also protect our employees and protect the general public who are interacting with our staff as well. We take these steps, and we don't take them lightly. I take the concerns that are being brought forward very seriously. We're open to ideas and discussions, and those discussions are happening with supervisors and managers, but also recognizing that, this has evolved and changed almost on an hourly basis. I mean, it's not, it's daily, it's weekly. There's new things that have come forward and new things that we've rolled out. And so I just wanted to quickly just provide that quick summary update on some of the actions that we've taken. If you have any questions, please let me know.
Yeah. Commissioners, thoughts or questions?
I have a question.
Please.
Thank you, Ken, for that and for all the work that's been done to make accommodations. I appreciate it. It's a lot of work. You mentioned there were 57 employees on leave. Are any of those out due to actually having been diagnosed themselves with COVID-19?
I don't have that data to that detail. And I'm kind of hesitant to, I can give a general number, but I want to be careful because it is a protected leave category, and in respect to employee privacy and potentially, I don't know if HIPAA would apply in this case, but, I don't have that information if there were any specific diagnosis for COVID.
Well, I'm just trying, so then 57 people are accessing any number of leave opportunities?
Yeah.
Okay, thank you.
Speaking, I guess I actually do have a question once I thought about it, Ken. The people, the 294 people that are working remotely, depending on 15 minutes or 30 minutes, are required to fill out the log of what their work accomplishment. Do they have to do that if they're working in the office? That log?
I don't know.
Because I guess my feeling about that is we're giving them the possibility of working at home. And if we're not requiring them to fill out a log when they're in the office working, it really tells me that, do we have really trust in our employees that when they're at home, that they're doing their work, that we're making them fill out the log?
I don't know if I would necessarily call it a trust. Issue. I think I would call it the challenges that a supervisor or manager may have, that if we're working on site, I'm on site with my employees, I have a basic idea what they're working on or an understanding, versus the challenges of having, if I'm a frontline supervisor with 5 employees and those 5 employees are all working from home.
Yeah.
And I have to report to my department director that, yep, it's working well, we're getting work done. Or if there's a question about, well, this division is in need of assistance and we need to shift resources, do you have staff available? Are they staying, is there enough work? Are they too busy to shift over here, or do they have time to where you can shift that over? So it's more of a, managers and supervisors are using it to essentially know what their staff is working on. It's not an expectation that you report back every half hour. It is keeping a log of what you're working on, and at the end of the day, I'm not sure how frequently they're reporting, because it can vary from office to office and division to division on how they're reporting the information back to them.
And you feel pretty confident then that the managers and supervisor are actually looking at, because if it's in 15 minutes, but they're only turning the log once a day at the end of the day.
I haven't heard 15 minutes.
Or 30 minutes even, if they're doing it every 30 minutes, but they're only turning the log at the end of the day, it seems like a manager or supervisor could shift work that day because they're not getting logged till the end of the day.
Yeah.
So I really am concerned about requiring our employees to do, to me, some of it is a trust issue. If we are trusting our employees to do their job when they're in the office, and we're trusting our supervisors to manage that work, then I'm not, I guess myself personally, I'm not big in filling out those. At the end of the day, this is what I did today, fine, send it in, but they have to break it down into 30-minute increments. I guess I'm just not, I have an issue with that, but that's my question. That's my only question. Thanks, Ken.
Well, and I can speak to the departments who are doing this.
Yeah.
Yeah.
Thanks, Ken.
That sounds good. I mean, my understanding is that there are best practices and kind of standard procedures out in the world for departments doing this of different kinds, right? Whether it be like insurance companies or GIS departments, or those are the ones I'm familiar with. So And I would assume, but it's maybe better not to assume that departments have looked at what other departments and businesses like theirs are doing. So
You
It's
know,
good
and a
to
lot
check.
of the logs were actually rolled out before we even had the policy in place. You know, that was one of the first things.
Right.
I want to say HHS in particular was one of the first ones to really try to accommodate as many teleworking as possible. And I think a lot of the forms that are in question are HHS related forms. So I can talk to Lindsay and I can talk to Jason and,
Right.
and provide some feedback on that.
I mean, I can see also.
I
Thank you.
would
There we
like
go.
that
Yeah.
feedback, because I'd really like to know what the managers and supervisors, especially HHS or any other department, what they're really doing with that information. How do they, do they have faith? Because I could write down in half-hour increments. I can write down I did this and this and this and not didn't do anything at all, because I'm just turning it in a log. So I'd like that clarification of what they're.
And I was just looking over at our county council, because we do bill, your office
I
bills
was just
different
thinking that too,
departments based on county council time. So how does that work for you, keeping track of
Right,
your
some people
time
are
for
already
different
doing it.
departments?
You know, it's a much more standard practice in the private sector. We don't bill our time, to a client, to a matter in the same way that attorneys in private practice do. Attorneys in private practice are used to living their lives in 6-minute increments. You if you're billing time, and oftentimes the expectations of a particular firm might be that you bill 6 to 8 hours each day, which means you're working 10 to 12 hours to hit those billable marks. So I don't think we're doing anything nearly as onerous as that. But we have a table that we use for our budgeting, which we allocate in some block amounts certain charges to certain departments. That was a table that existed before I got here. But beyond that, we don't track individually. I can say for the attorneys that have been working from home, I've been touching base with them regularly, and we've been communicating, and I have a pretty good idea of the work that they're doing at home. And that's been the extent to which I haven't implemented a log, but I also don't bill like HHS might. I don't also bill back to the state for specific amounts that the county then receives to pay for the services that are being provided by the employee. So that it may have as much to do with a mandatory reporting requirement to the state to make sure that we're accurately tracking the client time that we're spending, so we can reflect that in our billings to the state. I honestly don't know.
And I can check on that, because it's my understanding most of that is tracked in their Juniper program.
Yeah. That's what I was worried about.
For billing. But again, hearing the feedback, I'll connect with those.
Okay, thanks, Ken.
Thank you for that.
You were thinking him. Sorry. I just thought you had another comment.
No, I was just thinking that's a lot of work to put together the report to us, and
Yeah,
also
that's
the
what I
work
was just
that went
about to
into getting all these policies in place. So thank you for that.
The one thing that I've been really impressed by, and this is a fully just really honest, is how quickly both of you have responded to this. And I've talked to a lot of people, and I hear from lots of people within the county, and I've tried to share that, right? That sometimes there's, as you said, sometimes there's an hour by hour disconnect between what people understand. And it's not even so much what they understand, just like they're just getting to it almost. And that, I think the same goes for the communication. So I want to echo Commissioner Starrett's comments about thanking you for putting together
Very good report.
kind of the report of what's happening. Because I can share 90% of that with somebody, but it's one person and it doesn't get all of the information to them. So what I was going to ask you, my main question is, can you provide that document to us so that if somebody talks to us, is it something that we can share?
Yeah.
Okay.
Yeah,
I just want to make sure that it's not. Yeah. Okay, great.
Do that, and then I'll also put it in the packet.
Great, thank you. And I appreciate you taking the time to share it now too, in response to comments, because I think it responded to a lot of in writing them down. I think you addressed a lot of comments and concerns that have been brought up. Any other thoughts
Good.
for?
Thank
Ken?
you.
Okay. We will move on from public comment, which is item C, to the consent agenda, which is item D, and we have nothing on the consent agenda today. Move on to item E, which is old business, and we have none. Move on to item F, which is other business, and item F1 is consideration of approval of reimbursement to the City of Tualatin for expenses related to officer training and employment in the amount of $47,095.59. And Commissioner, do you have any comments?
My
This
only
is-
comment was, and I had sent something to Ken and to the sheriff also, because I was kind of taken back by the amount of that. And I understand that there is state law that allows for that, and that we do it all the time in other departments. We let somebody go and they're hired by laterally by another department, that we get compensation from them. So other than that, answered my questions on
Well,
that. I thought it was a big amount.
We can request.
80.
We could request, because this is the statute tied to if you hire somebody who is within a certain time frame from another jurisdiction's law enforcement office, we're responsible for essentially reimbursing for the training time that it took for that officer to go through the certification process. The plus side, for us, while the downside is having to cut a check to that other jurisdiction, however, we're getting the deputy that's more readily available to, closer to day one, go out on the road. And so we don't have to, we're saving on some of the training costs that we have with a brand new entry level officer versus a lateral. So
And it would have cost us more than this
Right.
if we had somebody who was a new recruit.
I forget the
Sure.
number, but it's
It's-
between 150 and 200, something
It's
in that range.
significant. I don't know why 80 is sticking in my mind, but
Okay.
in any event, it's quite a bit more.
The sheriff may have put that in his memo.
Yeah, he may.
Yeah, he did, and I can't remember the amount, but you're right. it
But
is.
it's still more than
That's right. This
47, yeah.
This just surprised me that this was even something that on lateral moves for law enforcement, that's commonplace. I certainly understand it,
Mhm.
but it just drove me. I thought that was an awful big amount. When you start looking at all of the certifications they have to have, the academy they have to
Mhm.
go through, and equipment, I guess it did. When you start adding up that way, it's a good deal.
A bargain at twice the price. Thanks.
Okay, well, I also understood what was happening, and I would entertain a motion to approve unless there are more comments.
I would move approval of item F1.
All in favor signify by saying aye.
Aye.
Any opposed, same sign. Let the record show unanimous approval of item F1. Item F2 is consideration of adopting resolution 20-04-16-1 proclaiming April 20th through the 24th of 2020 as National Crime Victims' Rights Week.
I would move approval of item F2.
And
Oh, you have to read it.
my memory is that I have to read it
You have to
before
read
we
it.
vote on it.
Okay, got it.
Okay. And does anybody else want to read it? I'm happy to.
Go ahead.
In the Board of Commissioners of the State of Oregon for the County of Yamhill, sitting for the transaction of county business in the matter of a resolution in support of National Crime Victims' Rights Week, which is April 20th through 24th of 2020, and is resolution 20-04-16-1. Whereas over 150,000 Oregonians are directly harmed by crime each year, and the physical, emotional, and financial impact of crimes falls on people of all ages and abilities who come from all economic, racial, and social backgrounds. And these crimes affect many more family members, friends, neighbors, coworkers. And whereas victims who feel understood and supported are more likely to disclose their victimization, seek services, and participate in the justice process. And whereas providing victims with knowledge of their rights and available services further strengthens their ability to recover by restoring the sense of empowerment. And whereas a trauma-informed response to victims promotes healing and fosters strength in survivors. And whereas we celebrate those who provide hope and support to crime victims, or child victims of violence and sexual abuse, stalking victims, survivors of homicide victims, victims of drunk driving crashes, and victims of domestic, dating, and sexual violence, and many other life-altering crimes, and their commitment to respect and enforce victims' rights and to address their needs. And whereas National Crime Victims' Rights Week provides an opportunity to recommit in ensuring that all victims of crime are afforded their rights. And whereas Yamhill County is hereby dedicated to strengthening victims and survivors in the aftermath of crime, building resilience in our communities and our victim responders, and working for justice for all victims and survivors. And now, therefore, the Yamhill County Board of Commissioners do hereby proclaim the week of April 20 through 24, 2020 as National Crime Victims' Rights Week, and reaffirm Yamhill County's commitment to creating a victim service and criminal justice response that assists all victims of crime during Crime Victims' Rights Week and throughout the year, and to express our sincere gratitude and appreciation for those community members, victim service providers, and criminal justice professionals who are committed to improving our response to all victims of crime so they may find relevant assistance, support, justice, and peace. Done this day of 16th April 2020.
I move approval of item F2.
Thank you. All in favor signify by saying aye.
Aye.
Any opposed, same sign. Let the record show unanimous approval of item F2. Thank you, commissioners. Item F3 is consideration of ratifying the new temporary coronavirus/COVID-19 emergency leave policy, which is the EFMLEA and the EPSLA, which is also known as EPSLA now and forever, repealing the current policy, which is Board Order 20-118, and ratifying the new policy effective immediately. And thoughts, we've talked about this and it's in the packet. Do you have questions for Ken?
No, I think,
Okay.
I think the only thing is Ken did a very good job again of explaining it to us and bringing us to where we need to be. So I'll make a motion that we consider that we ratify the new temporary coronavirus emergency leave policy, repealing the current policy, which is Board Order 20-118, and ratify the new policy effective immediately.
All in favor signify by saying aye.
Aye.
Any opposed, same sign. Let the record show unanimous approval of item F3, and thank you for getting that together so quickly. Item F4 is consideration of a 30-day extension to the current COVID-19 paid administrative leave policy, which will otherwise expire on April 17th of 2020. Commissioners?
I'll move to approve.
All in favor signify by saying aye.
Aye.
Any opposed, same sign. Let the record show unanimous approval of item F4. Item F5 is discussion about process and schedule for conducting the Yamhill West Sider Trail remand public hearing currently scheduled for April 30th of 2020. And commissioners, and I think we do have our planning director here. If we have questions or want to address it again, yes.
Yes, Mr. Chair, I asked that this be put on the agenda again, and that was
Okay.
because last time I had said, it seemed that if we had a representative from the opposition to the application, that would be enough.
Yeah.
But then we got a lot of emails. At least I'm sure you got the same
I did too.
amount of emails.
Yeah.
And they made the case for saying that they believed they wanted to be able to be part of this. So I kind of see both sides, but I do want to just read the names of the people. They asked that their letters be read today. And instead of doing that, I would like to acknowledge that they did
Okay, great.
send
Thank
us
you.
letters. And that would be a letter from Julie Van Dyke asking us to change the date of the hearing. Chris Mattson says the same thing. Celine McCarthy wanted to also weigh in on that. Becky Gagne and Mr. Vandershoot, also Lee Schrapel, and John Van Dyke. And so I just want to acknowledge their letters and say that and just wondering whether or not it would not be more fair to have them have the opportunity to be at that hearing. That's just a suggestion.
Okay, thank you.
Question, I think a couple of those, like John Van Dyke's and everything, weren't those entered in our first, didn't we receive those as part of our first packet of public comments? So anything that Commissioner Starrett has that has not been included in the public comment, whatever those are, I would recommend that they be entered into the public record.
Okay.
Those particular emails. My feeling is on this whole thing is I think the people that are asking for a delay, I think the delay is warranted. My only thing is we have to make sure, and they have to understand that if we receive any public testimony, that testimony only be limited to those items that have been remanded. No other general testimony, no everything. And that's going to be hard to track, but it can only be public testimony only for those items under remand. So maybe
I was
Ken
gonna
has
say,
some-
hey, can you come up
Yeah.
and talk about this? Because I was gonna try to do the freshman land use answer.
Oh, that's right. As I mentioned last week, this is up to the board. If the board wishes to receive testimony on the 30th and then continue it, which is kind of what I expected was going to happen, they can do so. If in the alternative, the board wishes to have our office send out another notice that cancels the 30th and schedules it to another time, we can do that. And we'll just follow your direction on it. And I can explain, why it was selected the way it is, but
Thanks, Ken.
And can you comment on the Commissioner Olson's thoughts about addressing, because I was going to address that, but you have a much better sense of.
Well, with any remand, there's we try to focus the testimony on to what the issues are, but it's very difficult to do that, and it kind of puts the staff in a position of saying this should be in and this should be out, and usually it's just easier to allow everything in and then have the board focus on what the issues are and then decide based on the evidence and testimony that's been submitted. So I like the idea, but I hate the idea of having, identifying what's in and what's out, because someone who is just saying they're in favor or they're opposed, they don't feel like they're listened to if you decide, well, you've only said that, you haven't addressed the actual issue, so we're not going to take that in as part of the record. I don't want to see that.
Well, I think maybe we could actually resolve that by, at the beginning of the hearing, is if the chair just announces that we would like to keep it to what's on the remand, but if somebody else wants to speak on something else, but.
And I think that's great to focus it as much as you can, but realize some people just don't understand that really we're focused on certain issues. So.
And Ken, we're not under, I believe, we're not under any particular timeline that requires us to get it in April 30th.
That's correct. There was a timeline. There was a timeline for the applicant to request the hearing, and there is still a timeline. The timelines have not gone away, but we're the ones that would be objecting if it didn't make it in a timely manner. And so as long as the board doesn't object to that, then I don't see that there would be any sort of timeline.
Yeah.
Thanks, Ken.
Okay. I think my first thought on that is to ask Ken, what's the you explained to us last week that remand hearings are often just written comments. Can you elaborate a little bit? Because I tried to explain to some of the emailers, and I realized that if we are going to talk about it again, it might be just good to have Ken Friday.
If just to kind of explain my decision, I decided to do what I would normally do in an application. I tried my best to schedule it in a timely manner, and that was at the request of the applicant. And I did talk to Todd about, well, what about continuing it until May or June? And as Ken Huffer mentioned, this is changing by the hour, and he said, "Do you really think that's going to change in that amount of time?" And I couldn't say that it would change the limits that we have on meeting together. And so I was the one that came up with it being written testimony only, because we had previously done that on the Riverbend landfill application. And I do think it's fair to both sides for it to be written testimony only, while at the same time protecting the public. And I did think, I knew there were going to be objections to that, but I also knew that there would probably be some people that might actually like to have something to do during this time. And if we schedule this right after everything opens back up, I bet we'll get complaints that why are you scheduling this now when we can finally go places? So I knew either way it was going to be a challenge. And really that written testimony only isn't something that we do a lot, but we do it on ones that it's a remand, and it's one that has had several hearings on. This one has had, at my recollection, 5 hearings, and I think the last 2 hearings were 4 hours and 6 hours, if I recall correctly. So that being the case, I selected the written testimony only. It's a different thing. It's not unusual, though. We've used it before, especially on a case that was a big case that's being narrowed down in what the issues are. But I do want to say it's totally up to the board. I want this to be fair. I want the sides to feel like they've been heard. If the board feels like it'll be better to have it where people can give oral and written testimony, I'm fine with that. I just tell me where you want it and when you want it, and we'll send out the notice. Or you can open up the record on April 30th, take the written testimony that's been submitted, and decide to continue it on at that point. And you don't need a new notice on that. But I don't mind at all if you decide to do another notice. It's a large notice, so give us a little time, but we can do that.
Okay. Thank you, Ken. Do you
I
any
have a
thoughts to
question.
return?
Yes,
Yeah.
Mr. Chair. So clarify again, having the hearing, written testimony only on the 30th, the board then at that time has the option of having a hearing where there's oral testimony as well.
You could decide, this isn't good enough. I want to hear from both sides and continue it on. I don't think there's any limit on accepting additional testimony. I do think I would probably lean towards, even though I don't want to do another large notice, I would lean towards doing the notice if you can come up with a date and time and idea of what you want. I lean towards that just because it provides a little greater certainty. But, April 30th, we'll probably have a little greater certainty also because we'll know a little bit better than we do today on what might be opened up and what might not be opened up, and whether we will be back to some semblance of normalcy. And that was also a challenge when making the decision to go with April 30th. Well, I figured by April 30th we would know better, and the board would, take action at that time to either decide to continue it for a few weeks to read what was submitted, or continue it for a longer period of time.
Yeah. Okay. Do you have any further thoughts? Okay, I was going to just do a little clarification then too. One thing I remember hearing I haven't been involved in all of the public hearings the way that you have, but I do remember hearing it from Ben Van Dyke, among others, that he wished he didn't have to be there for, at that point, I think it was 6 hours. April 30th is in the middle of field prep and spring work, but every time it rains, somebody will have the opportunity to come in and write a few notes and collect their thoughts. And so I think from a practical perspective, this an April 30th that has adequate time for people to provide written comments as a starting point seems appropriate to me. And that might be as biased as a person who I definitely work better when I see the things in writing. I can make notes and make comments on them in anticipation of bringing up questions. So I, thinking about the number of hearings that we've had, I understand Director Friday's initial consideration there too. And that's what I lean towards. And mostly, and there's a secondary thought that is, I don't know when we would make another, look into the future and see, at this point, I mean, we're going to talk about that, I believe, in a little bit. So I feel comfortable with starting with April 30th and written testimony and then moving from there. And I want to do a thank you for the explanation of that.
Yeah,
And
but
our options.
I think, Casey, I'm looking at it the same way you are. If we started April 30th, and for written testimony only, then at that time, April 30th, we could actually just continue the public hearing to a later time, whatever time that would be, if we wanted to accept oral testimony.
Mhm.
And I think at this juncture, we don't know how long the shutdown's going to continue. So we couldn't even speculate 30 days, 90 days, they're talking 18 months. I mean, what are we looking at here? So I would agree that if we at least use April 30th as a starting point,
Okay.
with the acknowledgement that the option is there to include oral testimony if and when the shutdown is.
And perhaps with some flexibility too. I see a lot of innovation out there among businesses, and obviously within our own departments. So it may be that if we decide at the end of that April 30th, we want to have in person, we may be able to figure that out. We're having budget meetings after all, so there's more people.
Sure.
So I feel confident that if we decide that we do want to hear it, that we can probably figure that out.
So this doesn't require a vote because we're just discussing this, correct? We've already decided we're going to do the 30th and start there.
Right, and then there's the notices out.
Okay.
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 Well, thank you,
Thanks,
Commissioner.
Ken.
With getting so many comments, I'm glad that you put it on
Yeah.
for further discussion. I really appreciate it.
Thanks, Ken.
Thank you, Director. All right, we'll move on from item F5 to item F6, which is consideration of approval to authorize HHS Director Lindsay Manfred or designee on behalf of Yamhill County Health and Human Services to submit an application for COVID-19 telehealth program funding through the federal, or to submit it to the Federal Communications Commission, not to exceed $750,000. And I'm really pleased to see this because I remember when I saw the opening of the grant program or the funding opportunity, I thought, oh, we should do this. So, Commissioner, do you have thoughts?
Oh, just that this funding is part of the CARES Act. So
Yes.
it's been there. It's a pot of money, and it will certainly shore up the telehealth component of what public health has been doing.
Yes. Yes. And I'm really grateful for Ken and for Director Manfred's work to get us this far. I feel like we're ready. Look, based upon what I looked at, it's like we're really ready to ask for funding for it.
Yeah, I think it's a great idea to ask for funding. One of the teleconferences call I was on yesterday. Also, there's things going on in Washington that they're looking at, specifically giving counties or underserved internet areas funds for developing rural broadband.
Okay.
Mhm.
So we may see something like this coming back for rural broadband too. So
Okay. I've been wondering about that.
yeah,
Yeah. It looked like you had some thoughts.
No, I would just say I would move approval of item
Okay.
6.
Great. All in favor signify by saying aye.
Aye.
Any opposed, same sign. Let the record show unanimous approval of item F6. Item F7 is discussion of sending a letter to Oregon legislators requesting the governor lift Executive Order 20-12 and allow for decisions based upon local jurisdictions, case count, and hospital capacity. And Commissioner, because I
Yes.
believe it was yours,
This is
based
mine.
upon our phone call, the legislative committee phone call on
Yes.
Tuesday?
I'm going to pass that over to Carolina. There's one for Ken and one
Which-
for you.
I wasn't sure if you guys knew, but I was listening, but since I'm not on the ledge committee, I didn't say anything. But I
So,
got to hear you.
one of the things that I've been looking at is our numbers and also looking at what is happening economically in our community. And so I had, what I'm suggesting that the board do is to agree to a letter to our Oregon legislators, Senators Boquist and Thatcher, Representatives Neerman, Noble, and Post. And basically, what the letter, this is just a suggestion, the letter in front of you says, talks a little bit about the executive order, what that did, and that on April 14th, that the governor stated that while our businesses remain closed, she would, quote, make use of science and facts to determine when the dictates of the executive order would be eased. So I was looking at some of the data, and I've got that in your packet and printed those out. Some of the data used to project the hospitalization and death threats has been perhaps vastly overestimated. And I wanted to look at some of the previous models that were used. So I've got those printed out for you. In contrast, if you look at prior years' data, and there's under the CDC printout that I have, talks about the year 17 to 18, the flu. And in 2017 and 18, if you look at the numbers compared to where we were in 18 and 19, this is, quote, the highest percentage since 2009 of a flu pandemic. And it was considered the highest in recent years, and also classified as the highest severity across all age groups, an extended period of time that we had emergency room visits and outpatient clinic visits. And there were no shutdowns.
Can you, which of these things are you referring
Okay.
to first?
This is the CDC flu view. Do you
I
have,
don't think I have
it's
that one.
a graph.
Wait, is it on? No?
Yeah.
I have it in mind.
It should be that one.
Oh, it just looks different than yours. Okay.
It does, because it printed out sideways.
Got
So
it. I'm sorry. I was just
There
like,
we
where
go,
is the
sideways
2018? I'm
commissioner.
sorry. I just really wanted to make sure I was following.
So I
Go ahead.
just by eyeballing it, you can see the 2017, 2018, 19, and 2019, the years of severity for flu. And in terms of hospital admissions and ED utilization, and that was what was, we predicated, the shutdown was predicated on, we don't want to overwhelm our hospitals. And that was going to be the problem, is overwhelming our hospitals. So if you look at the numbers that we have locally, and each of Oregon's 36 counties has a different scenario. Some counties don't have any COVID positive cases. Some counties, like the metro counties, have seen more. What I'm suggesting is that we consider the impact of this executive order on employment, the loss of business, suicide, mental health issues, the prohibition on worship service gatherings, the isolation it's imposed, the loss of opportunities for recreation. We've got our parks closed because we can't fulfill the mandates of the executive order. We've seen that our hospitals have seen reduced usage because medical care, it's just not happening. Any non-emergent medical care has been neglected. When this is all over, now we're going to wind up seeing an overload of our hospital system, our healthcare system, when people who've been forced to postpone care will flood the system. We've seen healthcare systems basically have to shut down, financial losses, and countless patients who haven't received medical care. And Senator Boquist pointed out that the quality of data being provided by the OHA has been what he called poor quality. As an example, I wanted to point out, and I've got that printed out for you, and it looks like this. The number of ED visits, emergency department visits, and the number of visits has peaked and is down to virtually minimal. So these cases, visits to the ED, peaked before the executive order. Right around the 15th of March, the executive order was on the 23rd. If you look at where that is now, and that's the blue line, it shows, and you've got that in your packet, commissioners, it shows that COVID visits are negligible. So we look at that data, and we also look at the fact that at the press conference, the governor acknowledged she would consider adopting a geographic approach to reopening the economy. I say let's encourage her to do that. Let's get our businesses back up and running. People who are either vulnerable populations who have underlying issues, health issues, or perhaps are older or have other concerns would not necessarily have to be out in the community. But let's let our businesses get back to work. If you look at the numbers we have now, all of the cases of all those fatalities, all of them were over 80, underlying medical conditions, and in one senior facility in Newburgh. Counties that have zero, like Gillum, Baker, Jefferson, and Lake, or few cases like Yamhill, Coos, Crook, Lincoln, and Grant, should not be forced to operate in that one-size-fits-all that we often hear about at AOC, which says, if you've seen one county, you've seen one county. There are 36 counties with 36 different experiences. And I would ask that our local leaders understand the needs of the residents here in Yamhill County and ask Governor Brown to lift her executive order restrictions and allow the local governing bodies in Oregon counties to determine what policies will best suit the health and welfare of each respective county. So I'm not suggesting that this is the exact letter we send, but that we encourage the governor to let the governing bodies look at the data that we have locally, listen to our communities who are telling us that they're having some significant financial issues as a result of this, and give us the option to ease those restrictions locally.
Okay, thank you for that presentation.
I went over an executive order 2012 several times, trying to look at it. I think some of the things in executive order good, but I agree with Commissioner Starrett's opinion, which is definitely true. My only concern is by allowing counties, and I believe it's important for Yamhill County, Lincoln County, all those counties to have a decision to open up themselves. Now, if you can imagine the cases they're having in Multnomah County, Washington County, if all of our businesses in Yamhill County, our restaurants and everything were good, great for our economy. But then I can tell you, if Washington County and Multnomah County still have closure of all their restaurants, their bars, their taverns, those people are going to go someplace, and guess where they're going to come to? Yamhill County. So are we not, by doing that, are we not inviting others from the outside area come to support our economy, but yet importing some additional problems? I don't know, because Mary's right, the information that the OHA has given out is not good information at all. I believe the county should have more of a role, and I would encourage the legislature to write a letter saying that, hey, look at this again. You promised to do this. You haven't done this. When are you going to do this? So, number one, I don't think we're going to ever get Executive Order 2012 overturned or dropped. But I think there's a possibility that through the legislative and through the counties, we can ask them to make some changes or additions to 2012 that address like the local economy and address our own businesses and everything. Because I'll tell you, we're suffering. We're suffering. And I don't mind doing a letter at all to all the legislatures and the governor saying, hey, we want to do this. Will she do it? Absolutely not. But I don't mind sending the letter asking her to do it.
So with that, are you talking about sending a letter? Because my suggestion is we send it to the Yamhill County, Oregon legislators that represent Yamhill
right.
County,
That's what
and
I was
asking them to advocate for us to the degree that there's any wiggle room, that what could we ease, what restriction could we ease based on the fact that our cases are minimal, and allow them to do that for us, since they do represent Yamhill
That's
County.
what I mean. I definitely do that. And, if they do that, that doesn't mean we have to take advantage of those things. It gives us the capability of taking advantage of those things. So a letter to the legislature asking them to work on our legislative delegation, asking them to work on our behalf with the governor to allow us to have more control over what happens locally, I have no problem with that.
Thank you.
Okay, so my thoughts then.
Your thoughts?
Yes, it's great. I really appreciate your advocacy for things that I'm not advocating for, because it does, sometimes in my head, I say no, and then I find myself thinking, which is probably good, right? Reaction, and then unfortunately nobody can hear me when I'm thinking in my head. Right? Wait, you can? Okay.
No, I'm just
you
trying
made
to,
it look like.
I'm just trying to follow.
She's
Um,
telepathic.
What I do think is, I think it's important to I think it's important for counties to have the conversation with the governor's office about each individual county's their needs, like their need for personal protective equipment. That definitely differs between counties, and the need for testing capacity. One thing I really appreciated was that when the state got the 15 rapid test machines from Abbott Laboratories, that they first went, because we didn't have enough reagents for all of the 15, that they first went to rural counties where you can't get a test back into a lab in time, or it's more challenging. What I do think is that if counties are going to open up in a geographic manner, which I was watching the press conference as well, and that question came up. I think that, well, I mean, it's not that I think. The epidemiologists and the public health officials that I talk to say that those counties are going to need adequate testing capacity, and adequate personal protective equipment, and adequate ability to contact trace in case an outbreak shows up, a community-acquired illness in those communities, especially because if a community opens up before, a county opens up before another county, for example, if a county on the coast that doesn't have very many cases, my home county of Lincoln County, for example, my mother works at North Lincoln Hospital. They want to be very, very prepared in case lots of people come to their county, the way that you talked about businesses having people flocking to them in our community, the potential for that. A couple of things I do want to address is that Yamhill County per capita has one of the highest case rates right now, which is different than saying counties that have few. And we also have one of the highest death rates, mortality rates in the state. One of the things that the letter currently states is that to date, this is what the letter states, and this is not actually true. What currently the letter states, to date, Yamhill County has had 6 COVID-19 deaths, all people over 80. That is true, with underlying medical conditions in one senior care facility. There's nothing besides, and then it says with 32 people testing positive. Yamhill County as a total, as far as I understand, has 32.
33 as of today.
33, right. So that's the county. The suggestion in this is that they're all in one facility. And I think we have 12 of the cases are associated with that independent living community.
Correct.
I
I
don't
thought it was
think
11 or 12, because it
Yeah,
was
I think
6 and then 5 were positive in the same facility.
Right.
But
And so I want to be clear that that 33, that's 20. What we're doing 21 cases that are in the community that aren't associated with this facility. That is still a high rate compared to other counties in the state. But
Casey, can I ask you a
Oh,
question
yeah.
real quick? Just a question. But the letter, if I remember right, says the 6 deaths were attributed to the community. It doesn't say the total number of cases.
right, so I will read it again. Yamhill County, to date, Yamhill County has had 6 COVID-19 deaths, all people over 80 with underlying medical conditions, in one senior care facility with 32 people testing positive. So the way that it reads right now suggests that all 32 cases in Yamhill County are in that senior facility. That's just like how it reads.
Well, that's
No.
not what I get out of it.
And that's not correct. And I just want to put that out
no,
there.
that's not what
So
it
you,
says.
Commissioner, you also, it is what it says, it's how it reads. But Commissioner, you also brought up that the most vulnerable people among us would not, quote, not necessarily have to be out in public. And I just want to comment that I actually received an email from somebody that said that, and multiple people have told me that we should have elderly people and people who are at high risk, they should be mandated to stay inside. and not be out in public. And so I want to put, you didn't say that, but I wanted to caution that suggesting that only some people have to be isolated is, to my mind, very dangerous from a civil rights and constitutional rights perspective.
I didn't say that.
I know that you didn't. What you'd said was that they would not necessarily have to be out in public.
If you chose not to, but healthy people could go to work and open up their stores.
Yes, exactly. So healthy people could, and then people who are associated with a family where there is somebody who is elderly or there is somebody who is at high risk would automatically be cut out of that. But other people have suggested that they should have to stay in. And I want to acknowledge that that is a very dangerous, in my perspective, thing. Okay.
Well, whoever suggested that, I'd say they're wrong, because if this applies, this should apply to everybody. If they feel like self-quarantining and staying home, they should, but to actually mandate that people of a certain group stay home, I don't think, I don't agree with that person if that's what they're mandating.
Okay, so I'm going backwards
just-
through the letter. I apologize. Oh, yes.
I just jumped in
Yeah,
here about
please.
quarantine, because
Yeah.
we have typically, and a public health response is to quarantine people who are contagious. We
Right.
do it with tuberculosis patients oftentimes. To quarantine people who are sick,
Mhm.
that's quarantine.
Right.
That's a public health response. To quarantine people who are healthy, that's tyranny.
Right.
And we are healthy, and people are being told you can't go to the parks, you can't go outside, you can't go to a church service, and you can't go outside and be in groups of more than XYZ. So the difference between quarantining healthy people, and sick people and healthy people, two different things.
Okay, great. Thank you for that clarification. I want to say that I was actually coming to that, but which is the one size fits all model. And I don't think that that is an example of tyranny. And the executive order for 20-12 is not, to my mind, an example of tyranny or a one size fits all. The way that I have read it and the way that I've explained it to business owners is, if you're not on this list of specific businesses that are called out, then here's what you need to do in order to remain open. And you can go outside. There's nothing, you can travel as needed. It is intended to flatten the curve, right? We'll acknowledge that. And in rural communities, it's a lot easier to get outside and stay away from people than in other parts of the state. But I wanted to go back to, this was the one that is, to me, the most important here, because there's talk about poor data quality. And then it says an example of that is that COVID-19 numbers peaked before the governor's executive order went into effect. So I just want to acknowledge that this is actually from April 4th,
Mhm.
right?
That's the end date.
That's the end date on this one. Right now we're at April 14th. No, 16th, right? 16th. Is there a reason why we don't have that printed right now?
Because I didn't have that data. Now, the point I'm trying to make with this graph,
Yeah.
Commissioner, is that if you see where the emergency department utilization peaked,
Mhm.
you start to see it, or start to begin, I would say, around what would be the 10th of March,
Mhm.
and probably the 15th of March, 20th of March, and we start to see a complete fall off of ED utilization for COVID visits after the 29th of March down to the 4th. So the point being is, it doesn't necessarily need to be current, because I'm talking about the executive order as the marker here as the 23rd.
So thank you. And what your letter says is that COVID-19 numbers peaked before the executive order. But what you're talking about right now is emergency visits that are related to COVID-19. As of April 4th was the most recent data in it. But this figure is the one that would refer to COVID numbers.
Mhm.
And if I'm going to assume that everybody understands how the figure works. So it's day of onset, right? And then each bar is the length of, corresponds to the number of people who have tested positive, who had symptoms onset, right, on that day. So the thing is that this is completely different. This graph is completely different now.
Well,
Like if you look at yesterday's, for example, and this is what COVID numbers are, not what this is emergency visits, right?
see, because the whole justification for the shutdown was overwhelming our healthcare system.
Mm-hmm.
And that has not happened. That has not happened. That's the point of this. So when we talk about the numbers that we're supposed to get a surge on the 24th, we're supposed to get a surge which will supposedly overwhelm our hospitals on the
Okay.
24th of April.
Yeah.
If you look at the numbers heretofore and up until now, we're at about 8% capacity in our hospitals. We're laying off hospital workers, and we have empty beds everywhere. So the whole point is a justification for shutting down was shutting down the economy so that we don't overwhelm healthcare. Well, healthcare is now dying because nobody's in the hospitals.
Right. And Senator Boquist is working on that. But I want to come back to this because this is a figure. This right here is cases by symptom onset date. And then the chart is hospitalization. So the reason why it goes down, why do you think it goes down towards the end? I mean, because it says it, right? It says it's because illnesses that began during this time may not yet be reported. It's up to 10 days lag time, right? Because only the people that are right here who say on the, today is the 16th. So if there's a number for the 15th there, that means that symptoms onset was that day and there was a positive test that same day, right? And that's a person who went into the hospital desperately in need of help. And that point was there. So the numbers in this period, right, as you move forward in time, those numbers go up. So if you look at the model, or sorry, this same curve, if you look at it today, as of April 15th, right, because that was yesterday, they don't have the data yet. Well, they probably do now, but this looks totally different.
So I think you're missing the point. And the point is,
Yes.
if you take a look at this document that our public health director, our health and human services director sends out
Yeah.
every single day, okay? We have not seen that precipitous spike we were told we were going to see.
Right.
We still have 6 fatalities of people over 80
Right.
in one nursing facility with underlying health conditions. The point being that this is not a flu virus. This is not an infection that is circulating in the community to the degree that we are seeing mass infection, mass visits to EDs, mass hospitalizations, and fatalities. So when you've got 6 people dying in one facility, 12 of those total cases out of the 33 that are 80 and over, this paints a picture of not this immense sky is falling rate of infection in our communities.
Mm-hmm.
When you talk about the that per capita, we have one of the highest incidents of COVID in our community. We have to remember that the vast majority of people who are coming down with COVID
Mhm.
are not being hospitalized and are not dying.
Right.
So all I'm saying in this, and we could sit here and as you know, figures can lie and liars can figure. I think what the whole point of this is to say that the sky is not falling, that the projections that they gave us are in fact not even close to what we're seeing, and that it's time to get our businesses back open. And all I'm asking the board to do is to send a letter to our senators and our representatives saying, would you urge the governor to ease up on those communities that look like they might be willing and able to get back to work? Because what's happening is people are losing everything and they're losing hope. And there's no end in sight because you got a paycheck and I got a paycheck and everybody in this room got a paycheck yesterday. But guess what? I can sit here and tell you 20 people I know who have put everything into their businesses and now they're about to lose it all. And how much longer is this going to go on? And to be perfectly honest, I don't have an awful lot of faith in what the governor is doing because I now think it's become political and it's time for it to stop.
Well, one of the comments.
And I'm still working my way through the letter,
Oh.
so I have more questions.
Okay, go ahead.
But I
My
also want to
only
make sure you have the
comment
opportunity.
is, and I agree with Mary, that if the sky was gonna fall, and if we had all this big spike coming up and we were gonna be totally overwhelmed, would the governor send 140 respirators to New York City?
That they turned around and sent somewhere
That they
else now.
sent to Michigan?
Yeah.
You know, so it's like, if we were gonna have these numbers, and her feeling is true, wouldn't we kept those in our surplus stock and not send them elsewhere?
Good point.
So, but anyway, go ahead, Casey, sorry.
Okay, no, it's okay. I just, I think it's important that you bring that up. So the question I had next was, it's related to the comment that you made, which is that you say the previous models, and I'm not sure which the previous models you're referring to, used have been shown to be inaccurate. Was that with reference to the CDC?
That's the IMHA,
Okay.
IHME,
The Institute for Health
Metric
Evaluation and Metrics.
and metrics,
Yeah.
correct, which have been wildly out of whack.
Okay. And forgive me if I don't understand, what about them has been wildly out of whack? And also, I mean, the governor, as far as I understand, is also using the Institute for Disease Modeling.
And so the IHME, those figures have been shown to be, I don't have them in front of me, but have shown to be completely and utterly misprojections. And that's what everyone is basing on their executive orders on, are those numbers that aren't even close. For instance, there were a total of 9 people hospitalized at OHSU,
Mhm.
nine ICU patients. And the capacity is so much bigger than that. So what I'm saying is,
Yeah.
and I don't want to belabor this other than to say that we have been told that this is going to be, I believe, something that is not materialized. And I think in the meantime, businesses are dying.
Okay. Thank you. It was helpful for me to understand what you were referring to. Based upon what I understand, based from the emails that I get from Senator Boquist, and it sounds like you get the same ones. The Oregon Health Authority works closely with the Institute for Disease Modeling in Bellevue, Washington. And so I just wanted to acknowledge that what those folks say, and those are the folks who are advising the epidemiologists of the Oregon Health Authority. Those folks, and I've read their model, and it's the model that many others are using around the world, CDC, WHO.
WHO.
And we can totally, I'm happy to engage in a conversation about whether the WHO is scientifically accurate or not. But unless you can tell me why they're not scientifically accurate, I'm just going to go back to what I was saying, which is that the Institute for Disease Modeling reports a 55 to 75% reduction in cases due to aggressive social distancing measures in Oregon. Their model for Oregon, if we go to moderate social distancing, which is essentially what you're proposing, or you're asking the legislators to ask the governor to do, which I don't really understand. Why don't you just ask the governor? But that's an aside for another day. That one projects a greatly increased rate, or greatly increased number of cases. And so I just want to acknowledge that based upon what I understand from public health authorities and epidemiologists, the things that we've done have decreased the number of cases in Oregon. And I just want to acknowledge that. And I think that's why we're having the conversation about opening up and the steps we can take to open up. And I think that your letter is an important component of that. I don't think that it's appropriate to send this letter, though.
Okay.
Yeah, okay, yes.
Okay.
I just wanted to, go ahead, Commissioner.
Mike, I guess I have a question for you, Commissioner Kula.
Yes.
Is that the IMHA stats say if we went from the social distance we have now to less of a little social distancing,
Right.
that would make a 55% difference? Is that what you're saying?
No, so their conclusions, this was from Sunday. I got it on Sunday, but I think it was from the 6th or something like
Okay.
that. But that's when Senator Wilk sent it.
Right.
Their conclusion is that we've seen a 55 to 75% reduction in the number of cases because of the aggressive, what they call aggressive social distancing measures. I don't have the statistics off the top or the numbers off the top of my head for what they project if we move from aggressive to moderate.
Well,
Does
see,
that
and
answer?
Yeah,
clarify it?
That clarified, because where's the I mean, what numbers are they using to justify saying that if we've seen that decrease, 55% decrease now due to the strict social distancing, if we turn some of that off or portions of it off or whatever, where do they get the numbers that say it's going to go up, back up? I mean, that's what I have from. I don't know where those numbers,
Yeah, I
and I'm
mean,
not a big numbers person like you.
You could certainly, I read their methods and it corresponds with what I've read other places. But I think this is a situation where I also have to choose to trust the epidemiologists that they know more than me. Because Commissioner Sterrett wants to say something.
Oh, I just wanted to jump in here. And when we talk about, well, it must be the social distancing, the physical distancing must be working because look at the rates are dropping. Typically, do you know what the typical peak flu season, when it peaks and when it wanes?
I don't,
It
but I bet you
starts-
can tell me.
It starts in December and it typically high activity January and February, and then it levels off in March. So this is the natural progression of flu. Flu virus is not going to leave. It doesn't go anywhere. It stays. It just
Okay.
becomes, it's dormant or active. But if you look at it, and I want to go back to why this is so important, and this is really telling right here. This is a number at the very bottom, and on your graph, you're going to see it in a horizontal version. But just 2017 had high activity January and February nationally, remained elevated through the end of March, peaked at 7.5%, the highest percentage since the 2009 flu epidemic, which was higher than we're seeing now. And it was above the national baseline for 19 weeks, making it 2 years ago the longest and the highest number of cases in recent years. That's 2017. Nowhere near what we're seeing now. So yeah, flu season peaks January, February, and it wanes in March. So the reason why we're seeing social distancing working is because that's when the flu season typically diminishes.
Oh, so you're saying that this is following a trajectory similar to the flu virus. That's what you're proposing?
What I'm saying is that's what the numbers are showing, and that's what flu has typically always done. It's no different now, except that this is a significantly more virulent strain. What I'm saying is that, yeah, you can say social distancing is working, but that's what happens every year, and we don't social distance.
So do you, I actually haven't heard, do you have any epidemiologists who are saying that this is behaving like the seasonal flu in terms of its?
In terms of the numbers and cases?
Yeah.
I'm looking at the numbers, it sure looks like it
How
to
many
me.
people die every year?
Okay, I
And
just
the
haven't
number
heard
of
any,
people-
I haven't heard any epidemiologists say that. And so it's, but I don't know everything, obviously. I can't hear everything.
Well, I believe the COVID virus is going to be here from here to eternity. They're going to have antibodies for it. You're going to get these flu shots you're going to start getting are going to have it for that strain. So once that happens, then it's no different than 5 years from now, we'll be looking back and saying, oh yeah, it's like we look back at the bird flu, and how bad it was and everything. Well, now we're not talking about it. So 5 years from now, I think the COVID-19 virus will be talked about just the same way, except the difference is we won't have all the businesses to support everything we need to do.
So you are saying that that we will be lacking the businesses, but we won't remember the illnesses.
No, I'm not saying
Oh,
that.
okay. Oh, I know. I
I'm
just
saying
wasn't
we'll
sure
remem-
what you
We'll
meant by
remember it, but if you don't hear people going around day by day now talking about the bird virus or talking about the swine virus or anything like that, those are pretty major. So what I'm saying is in 5 years, you won't hear people going around talking about the COVID. It may be some other virus, but it won't be the COVID-19 virus because that will be in check.
Sure. So Commissioner, I want to come back to that. I think it's important to have your voice challenging the executive order. I do think it's important, which was coming back to that like random thoughts I had that I don't speak all the time. But I also want to acknowledge that in order to keep individual areas from having outbreaks because of the inevitability of people, as you pointed out, going to those areas, flocking in some cases to those areas. I want to acknowledge that we need to have the same milestones in place that the governor put out in the executive order. It's just within a localized area. And those would be the, no crazy amounts of hospitalizations. And that's in many areas, that is a check. They also need to have the ability to contact trace everybody. And I know that I've asked, and I know that in Yamhill County, they're keeping up with it. But in other counties, they may not have the enough staff to do that work on their own. So having the ability to have even the telework version of it deployed to those counties ready, having enough testing on hand, and having the personal protective equipment on hand, I think will be really important. And I'm just saying that because I heard, that's essentially what Dean Seidlinger, the state epidemiologist, was saying in the press conference. But I want to make sure that we're not also sending outbreaks and sending cases to areas. The state's public health officials group has a great deal of concern, my understanding is, with opening up areas before they're ready to be opened up. Because that will, each county is not a bubble. We have very porous boundaries. And so I just want to caution that while I understand your sentiment, I think that we have a ways to go before we can get to that point. But I also know that here in Yamhill County, we have people making the personal protective equipment, and we have ramped up testing capacity here. I see the signs of us getting ready to be at that spot. But I think that it needs to come from the governor rather than us asking our legislators to ask the governor. I just got an AOC email about a phone call tomorrow afternoon. I would imagine that you will.
I think that's Monday. Is that Monday? I think it's
It was-
Monday.
It was right before I came in.
I think it's Monday.
Oh, okay.
Monday.
Okay,
at
so it's the
3:30
normal
a.m.
AOC call is earlier in the day, and
Right.
it's on Monday that call will happen. Okay.
I don't know, I have so many on Monday. I
Yeah,
don't know what's-
Okay.
what's at what time.
So at the moment, I am not comfortable with supporting this letter, and I think that I would urge you to not send it unless you have changed it to reflect the accuracies or the updates that are in the current one. But if I'm not supporting it, I don't really get to say what's in it. So.
Oh, and only because the whole point of this is to show that where and along the lines of the executive order being put into place, the emergency department utilizations had already peaked. But that being said, if I think what I would do is call for a vote. And the reason why I'm not suggesting we go directly to the governor is that we have elected representatives. We have 2 senators, and we've got representatives who are representing Yamhill County, to ask them to go ahead and to,
I'd also like to acknowledge that we do have actually four. I just learned recently that we have 4 representatives and we have 4 senators. So
yeah, I know, but I've
Yeah.
written it to,
yes, you have written it to.
I have written it to specific
Yes,
senators.
and
Well, I guess,
Sure.
I guess my feeling on this whole thing is we do have our legislators, and that's what they're supposed to work on our behalf. That's their whole job. To tell you the truth, if the governor, and I believe this happens all the time, as county commissioners, we will, and you've heard on several of our town calls and conference calls where both Gomberg and, they said that where a local elected official could talk to like the governor or something, or a head of a department and not get through. But the minute a legislator
Mhm.
talks to them, then they're the governor and everything, they're a little bit more willing to listen because they're representing their whole area. And so I don't think it should be that way, but that's just the way it is.
So what if, in lieu of sending this letter with the particulars, that we send a letter as a board encouraging our elected representatives to encourage the governor to look at that geographic piece that she mentioned she'd be open to in her press conference on the 14th,
14. Yeah, that was.
and as a board, say, we would like you to consider easing some of those restrictions so that our businesses can get back to order, get back to business. Is that something that the board would
I'm
be
fine
in
with-
favor
I'm
of?
fine with that.
Commissioner Kula?
I want to be able to read it before approving it. So that's, or
Sure.
of
Sure,
agreeing to it.
and that's what I'm saying is
Okay.
I would send, provisionally, I would send it out before there was an agreement to send the letter out,
Mhm.
but that it would just be very, very, short and sweet,
Mhm.
that encouraging our legislators to ask the governor if she would look at easing restrictions based on county.
But she
I
did say
will-
that in her 14th press
I
conference.
am
Right.
comfortable with that, and I also want to make sure that I see it.
Oh,
And-
absolutely.
And if, I was just thinking about so the curve right now, so the way that, and this is just cases, and I just want to make sure that, because it's for the record that, so this is coming back to, I agree, I think that your letter provisionally sounds like a good plan, but this figure right here essentially looks like this curve up and curve down. And we'll say that here is stay-at-home order. Can you see that? Like on the curve. If you don't look at this area, because that's data that's coming in all the time, right? When you get a positive test, then you find out when the symptoms onset were. So this is changing all the time. If you take out, if you look at today's figure and you take out the ones that are where that's provisional data, I've learned to use provisional so much now. It actually looks like a plateau. Some days symptom onset test cases is 65. Some days it's 35. Some days it's 65. Some days it's 35. It does appear to be trending down, but right now, if that day is stay-at-home order, this is what it does look like now. And so I just want to make sure that that's clear. And you were also talking about emergency visits, and so I want to acknowledge that that's still the case. Emergency visits are still what you're talking about.
Because again, the whole premise for shutting down the economy and doing social distancing is we're going to overwhelm our hospitals. It never happened.
And now we're having hospitals in smaller, like Lower Columbia, Lakeview Hospital, ones in Eastern Oregon. They're talking about shutting down because can't do any elective procedures. And how do the small hospitals like that get that revenue? So the sad part about this, for the big metropolitan areas, it may be fine, but for some of the smaller counties, it's terrible because they're going to have the possibility of losing all health care.
Right, and I do want to acknowledge that, if you go to, I have not gone to Willamette Medical Center, and I've not gone to Providence Newburgh, but there, everything is done differently now because of the threat of coronavirus cases. So it's not like things are slow there just because they don't have elective procedures. I do know that Senator Boquist has advocated very vigorously on behalf of the Oregon Health Hospitals and Health Systems, I think, Association. I think that's what it is. And I know that as far as I understand, then because of that advocacy, the Coronavirus Economic Response Council or Committee, that's one of their pillars is supporting rural hospitals and small hospitals. I also know that there's at least a bit like 200 billion that's proposed at Congress that would come to hospitals, rural hospitals. So I know that people are working on it. But Commissioner, you wanted to say
No,
something.
what I want to say is that when we look at this money that's coming from the federal government or the state government, let's be clear that this money is money that we don't have.
Right.
So to say that at some point we're just going to keep throwing tax money after this instead of letting these hospitals do what they do, which is to generate the revenue themselves. But we're going to give business owners grants, and we're going to give hospitals some grant money. And at the end of the day, one figure is that some of these private clinics, some of these doctors' offices are going to have, they're looking at perhaps 50% of them not being able to be in business because they can't sustain having been out of work this long. So the
Right.
hospitals are not busy because they're not doing routine medical care, elective, non-emergent procedures, and that 60% of their revenue is just basically disappeared. So if you don't have COVID patients in the hospitals, because we don't, and you don't have routine medical care, what do you do when you start laying off? You're looking at laying off healthcare professionals. So that money is not going to just magically materialize.
Right. And it's a good point that as far as I understand, based upon what I've heard from Senator Roeblen and Senator Boquist, there's conversation about allowing hospitals to do elective procedures that involve personal protective equipment, as long as there's enough personal protective equipment in the area for a surge of cases. And I want to come back to that because North Lincoln Hospital and the health systems out in Eastern Oregon, if they see a surge in cases because people are coming there, they're not going to have enough equipment as it currently stands for that. And so I just want to acknowledge that as far as I understand, the reason why elective procedures have been on pause is because of personal protective equipment needing to be either used because it's being used at a high rate or because it's being held in capacity for surges. I do also want to acknowledge that as far as I understand, according to the Oregonian, there are positive coronavirus case patients in hospitals in Yamaha County. And you had said that there were none.
No, that's not what I said.
Okay.
I said we're not doing routine medical care and we're not filling up these beds to capacity, which is what we were supposed to do.
Okay.
And it's not happening. So I will go ahead and I will just draft something short and sweet that says we'd like to get our businesses back up and running, and we'll send it out electronically. And if we could just go ahead and I don't know, would we approve that? Put it on a list to,
If we could do telephone or if we could do video conference, then we could just call in on Tuesday
or you
something.
could do it by email.
You could call a special session to consider the letter.
Right.
Or we could do it on Thursday.
Or we could do it on next Thursday.
I mean, the other option is that if we did one on Monday before the phone call, right, then there'd be at least be a statement from the three of us.
Yeah, okay, we could do that. Well, but
I
then
just
we'd
don't
have to
want to
take a
bring you
vote.
back in
Well,
here
this goes down a little bit
unnecessarily.
deeper than this to me, and I guess when I get down right to the basic facts, I believe there is a pandemic. I believe it's getting better, but one of the issues that I'm really for is allow or not for. I think there's way too many times when the state government exerts power over the local authority, and I think this is kind of in a way one of those cases that, as a local authority, we should be able to do some of this ourselves,
Mhm.
and our local power, our local authority is being exerted. Now, I'm not saying in this case it's not justified, but I'm saying that's one of the things when you have somebody where we can't decide what's good for the county, and we're basically in charge of the county, that somebody's deciding for us on a higher level. I don't like that, but that's a whole different issue.
So maybe just ask our legislators to go to bat for us. But I will draft something for your approval.
Okay.
And then we can,
We can email.
I could send it to Ken, who
And he
can send it to
via
email. Can we, basically, can there be approval for this electronically?
No,
No.
but if we get it out.
Speaking of
where
that,
we can-
TriMet apparently did that.
If we can get it out and get it worked on and reviewed prior to next Thursday, then we can, if we've all decided on the format, then next Thursday we can act on it.
Let's
Yeah.
so then we'll just set this
Okay.
over then.
Okay, thank
Good
you. I
good
think you're right that
conversations.
geographic opening is important with some caveats. I'm still learning about these things, and your comment about the state versus the counties, I acknowledge that there's some areas where don't want them to be doing things. But correct me if I'm wrong, but we're essentially an agent of the state with public health. Isn't that how? I mean, the authority has been delegated to.
We are the
Counties.
local public health authority.
Yeah, we
The
are.
Board of
local health
Commissioners.
Authority.
Right.
Commissioners.
Right, but it's so some states the public health authority resides with the state. So we are doing the public health response. Whereas I just want to acknowledge that
We're doing
it
the
is highly
response.
distributed in our state.
But to remember, to be clear, that the Board of Commissioners is the local public health authority.
Right.
And with that authority, I think we would have some buy-in to what our constituents, what's going on, got the numbers. Lindsay Manfred's done a wonderful job of keeping us up to speed. And then the Board of Commissioners being able to weigh in
Mhm.
to our legislators. That's
Yeah.
what this is about.
Well, I think that with that acknowledgement, it might be good to also have Director Manfred weigh in then as our staff member who's essentially our designee for local public health.
Well, we have our.
About whether that would be a good
No, 'cause
idea.
we'd
And that's
be-
what staff does. I'm sorry, I interrupted
we'd
you.
be-
No, you did interrupt me. And what
Sorry.
I'd like to do is finish and
Yes.
say that Lindsay Manfred weighs in every day with data
Okay,
and has been very good at sharing that data with us.
okay,
We take the data and we are now tasked with promoting and suggesting policy.
Yeah.
So that's not the job of the Health and Human Services Director. It's the job of the local public health authority, which is the Board of Commissioners.
thank you for that clarification. I appreciate
Welcome.
it. Commissioner, you were
Confusing,
saying
isn't it?
something?
No, I'm done.
Okay, you're done.
So we don't have to take any action on this.
I'll bring something,
You'll
I'll
bring
have
something,
something in the packet for Thursday.
Perfect.
I'd like to think of both as a good conversation.
Thank
Yeah.
you, Commissioner.
Thank you for
It's
pushing
evidence,
this.
some of us know what others know, and others know what some of us wish we could do. How that goes.
Okay,
Okay.
we will move on from other business to item G, which is public hearings, and we have none. And we'll move on to item H, which is announcements, and we have none. Oh, wait.
Here he goes, speaking for us again.
Actually, County Administrator has something before we go further into announcements.
Good, yeah.
Yeah, I just wanted to let you know that Larry Klimek of U.S. Fish and Wildlife Service has reached out to the county, was hoping to get on the schedule, to schedule a time to come and talk to the board. He's the refuge manager for the Wapato Lake National Wildlife Refuge. And, part of it is in Yamhill County, and they're planning to do an opening of the refuge to the public this fall. They're currently completing 2 bridge projects to facilitate that. The primary access of the refuge crosses a short piece of road, approximately about 200 feet long, that the county owns. And he would like to come and discuss with the board and make a request that for access, whether through transfer, acquisition, or a permanent easement for that section of county-owned property. They're really hoping to open the refuge in late September. And it's something he's reached out to us a couple times, but current events have really kind of limited on being able to have him come and discuss or present. And so I'm thinking, I just wanted to see how quickly we could get something scheduled and I advise you probably rejoin us either via telephone or some other technology. So.
Commissioners, do you have?
Well, I guess my only question is Ken brought up 2 options, is that we provide them a permanent easement,
Mhm.
or that we vacate that and give them transfer it to them, right? Is that county, part of that county road used for anything else?
It's not actually a county road. It's a small little piece of property that we acquired through tax foreclosure years ago. It's immediately adjacent to the refuge there, and it's actually a little tiny segment that butts up against the county line. But it is a road in the sense that it's part of the path that the refuge uses to get to a new pedestrian bridge that they just built, which then leads to their trail network.
Oh my gosh, stop talking about, sorry.
No,
This
it's
is a
not,
joke.
it's not doing, it doesn't sound like that piece of property is doing us any good.
Well, and just
So
a reminder,
historically-
we granted a construction easement
Yeah.
on this property to allow Fish and Wildlife access for their project.
And historically, we held on to it. Previous boards held on to this piece when it came up for discussion about whether or not we want to sell this piece of tax foreclosed property or not. They held on to it, believing that there is a portion of the old UP rail corridor that runs immediately adjacent to this piece of property, and at some point in the future, this small piece could be used as a way to facilitate access from the refuge to the trail and vice versa.
Mhm.
So that's essentially what Fish and Wildlife is proposing to do with that parcel now. So really the question for the board will be whether or not, for our own reasons, we may want to hold on to it, in which case we could grant them an easement for use of the property, or simply transfer it to them,
Or so.
sell it for $1 bazillion.
Yeah, because so somebody can build a huge,
Can you
big
do that?
20,000 square foot mansion on that little piece of property.
It's really, really small. It's shaped
It's
like,
very small.
shaped like a J. It kind of comes around the corner and then leads right up to the pedestrian bridge.
But in the interest of, with the discussion, because with Fish and Wildlife, depending on their need or what they're going to propose,
Yeah,
maybe they're leaning one way, with a clear proposal.
right. I would be happy to hear from them. I mean, a permanent
too.
easement as opposed to selling would be my kind of initial thought, but you're probably right that it would be good to hear from
Yeah,
them.
my
Sure.
initial shot was just opposite of yours, because if it doesn't serve any other purpose, why are we hanging up a piece of property that we're probably not gonna get anything for it if we sell it anyway? I mean, other than the Fish and Wildlife. I don't see any developer, anybody coming in and buying that piece of property because with its limited access because of the refuge. So I guess I'd say take it off our inventory. We could give them up, but that, one of those things that would stay forever, but
Well, in the interest,
Commissioner Sarah.
again, I kind of wanted to put it out, how soon do you want to schedule something? Would
Yeah.
you like me to schedule something for next week or in 2 weeks, or maybe not?
Maybe not 2
Not
weeks.
2 weeks.
Stay away from budget week
Yeah.
or trail.
I think Commissioner Stara.
No, I was just
would like
going to say
weigh
that
in.
this piece of property has been in the book for years. I just remember we just keep
Yeah,
revisiting
I
it.
believe it dates back to many, many years ago when a drainage district or some sort of a group that was facilitating access to and use of the refuge land went bankrupt, ran out of money. And that's when it went through the property tax foreclosure process here. And yeah, at least as long as I've been here, it's been held onto as a potential link between
Yeah.
the rail corridor and the refuge for access purposes.
if we can get them to do it next week, I wouldn't have any problem having a short conversation or video. If they can have video with them.
Yeah. At worst case scenario, I think he's available with them.
And then
Yeah.
we could just have the
Yeah, we can have our
Like a map.
documentation and a
Yeah.
map and show you where it is,
Okay.
and he sent over some other information that we can compile.
That would be great.
Okay, that'd be okay.
Commissioners, okay.
Next week?
Yes, please.
Okay.
and
Thanks
that
for
just
bringing it up.
yeah, that brings up the fact that people have been asking us about opening our parks, and I guess if it were up to us, I know I sure would vote for that. But the problem is we've got mandates from the state and the governor's executive order that says you can't do it if you can't do this with
This.
sanitation in the basement, the bathrooms and the hand washing stations. So unfortunately, it isn't up to us, which is one of the reasons why if we had a little bit more leeway, we could say, you know what, it's a beautiful day, go out and get some vitamin D. But unfortunately, we can't because we don't have the manpower or the ability to do it.
Yeah, and I was going to ask along those lines. Commissioner Stara is right that there is a list of things that have to be done. Do you know if any of the parks could meet that? And I hesitate because if one's open and the others aren't, right?
I'll ask Jared, and then I'll share that information. I I want to empower our parks managers to be able to answer types of questions and not necessarily go off of, I have a lot of knowledge of history on the site.
That's a good point.
That's like,
Yeah, thank
that's
you.
like only using the, Kevin Jarrett has them saying, only using the ramp in the parking area at Rogers Landing and not using the whole park. So even our local fishermen, like right now, our local fishermen can't even get out on the
Yeah.
river.
Except
So-
at the ferry.
What?
Except at the ferry.
But we've got restrooms there, but we don't have the manpower to maintain those restrooms. Is that the issue?
Well, it's kind of all the above. I mean, there's maintenance limitations, limited staff, it's just, because again, Jared maintains the park system with the work group program as well. We
Yes.
suspended the work group program, and he still has his work group supervisors that are continuing to do some limited maintenance activities and limited work whenever they're able to maintain the social distancing and the types of things that they're doing. But as far as what may be required and knowing with how the weather has been right now, how many people, and knowing how busy historically Rogers Landing can get when the weather, as an example.
Yeah.
Then all of a sudden the maintenance demands and being able to keep up with that while at the same time making sure that it's sanitized, that we're not creating issues for that site or putting stressors on the maintenance of it. And then there's also the part of how to also maintain the social distancing. If the gates were open to the park and we have a lot of people that aren't necessarily complying with that, is there some potential exposure there?
Right. And a need to close it then.
Right.
That's all.
And so what I can do, again, is I'll if there's interest in looking at what parks and getting into more details of what came out in the governor's executive order, on what was applied to parks and recreation facilities, on the basic minimums of which ones could meet that,
Yeah.
and what that may look like, I can get a report from Jared.
I
That'd
think
be
that a
nice to
report would be nice.
let Jared put that together.
Yeah, that'd be great.
Give us a report.
I think
Not
that,
that
and I
you have
think
to
it's,
put it together, Ken. We'd like to see Jared put it together.
Yes.
yeah, I think you're right about that. Thank you for deferring to his judgment.
Okay, thanks, Ken.
Thank you.
Announcements back to.
Well, I only
commissioners.
have a couple of short announcements. One has to do with one of the subjects we were just talking about, is that social distancing. And I think this is something that really Cynthia needs to bring up with First Transit, is it's hard to maintain that social distancing when you see, like we have 3 buses in the transit center, and you see those 3 drivers standing right outside of the transit center within a foot of each other, smoking and talking. It's like, it's not a very good example to give to the public. So I think that's an issue we have to address.
Okay.
The other thing is yesterday, or today's Thursday, yesterday, I sat in, or Tuesday, one of the days, I sat in, Justin and I sat in with Sarah Architects on there. The first review of their space needs and building analysis. Very pleased with the work they did, and hopefully they will have to us by the middle of next week the first draft of that space needs and building analysis. And some things took me by surprise, some things didn't take me at all by surprise. But I think for long range planning going out 15 years, that it does really explain the shape of our, not just where our space needs are, but the shape of our buildings and what they're meant for and what they're being used for, and they shouldn't be used for what they're being used for, and all that kind of stuff. So we should see that, I think, Sarah said by the middle, Chris said by the middle of next week, I think we should see that. So I'm sure Ken and I and Justin will review it first and go over it, and then we can go over the whole.
Actually, Sarah's going to be.
Yeah, I was going to
doing
ask
also
Commissioner
with
Sarah.
each individual,
Oh, she's doing it with the other 2?
Yeah, I have
I
one
was-
today.
I was going to ask you,
You-
actually, have you been at?
Today at
Okay.
1:30.
Well, I thought.
Mine got
no,
canceled,
that's
so I'm on
correct.
Friday.
That's-
Yeah.
That's great, because it'll open your eye, it will open your eyes to a lot of things.
And just to kind of be clear on the process as well,
Yeah.
because they've had interviews with each department head, you know, they've kind of been, and so the next step was to have basically the get the feedback from each individual commissioner as well.
Yeah.
For scheduling the, you know, work session or what format it's gonna look like to come here and
Okay.
to make the presentation for you to deliberate and look at.
Okay.
Figure out next
Yeah,
steps.
because since they're just doing an analysis with estimated costs, you'll see it today. On the revenue side, it's pretty high. I mean, on the expenditure side, it's pretty high. But then when which they're not doing, they're not looking at the alternatives of how you minimize that cost. And of course, that's what we'll have to do after they're done, so. But you'll enjoy it. Sarah Group, I have to say, there are 4 people on the team, did a great job.
Yeah, and I also want to recognize Justin.
And I did
and Joe,
yesterday.
And you know, they've been the ones, Justin, he's taken full lead on this project and he's done a really nice job.
He's done a good job. That's one of the ones you'll see today is why I asked a specific question about our public health building, because, you know, we were gonna recite it, we were gonna fix the cap on it and everything. And I think it was $110,000 or something like that we were gonna do last year.
Yeah.
And we didn't do it, thank God, and we didn't do it. But
I'd also like to put in a plug for Sarah Architects that they are producing 30 face shields a week with their 3D printer, which I think is used to do their, you know, mock-ups. And they're going to start donating them to, or bringing them to public health for distribution in the community. So,
Good for them.
yeah, I know. I thought that's pretty
Everybody
great.
world-class.
Justin got them connected.
World-class technologies out on Lafayette Avenue. They make dental appliances and everything out of 3D.
Yeah.
They're doing the same thing. They're just, you know, they have enough stock, so they put their full shift work,
Mhm.
making face masks and or face protection shields and making all the stuff that they can with their 3D printer and donating it all. So
It's great. I'm really amazed by the ingenuity of our local manufacturers. Do you have,
Nope.
I'm ready to come to you. So,
Nope, all good here.
okay, me too. Christian? Okay, Carolina? With that, I will close this meeting of the Yamhill County Board of Commissioners. And I believe we also have an executive session, but should we take a 5-minute?
Oh, that's right, we do.
Do you still want to have the session
Um,
as late as we are?